Hello friends, this is Dr. Munjal Pandya from MedicalMCQ4All.com. Hope you are doing well. This video is regarding how to optimally use the website functions. So there are many doctors after subscription and after subscribing the website they are keep asking me how to optimally use this website. So this is a small video of the functionality of the website. So once you subscribe the website, alright, whatever the subscription you have it, you need to first log into the website, right? So this is the login detail. Here it's your detail, whatever the email you entered at the time of subscription and your password, then you are login. So once you are login, you will see such a dashboard, right? And there are various things: online courses, practice MCQ, mock test, read my favorite MCQs, your profile, communicating us, and my subscription, and review points or quick review points. So let me go step by step very quickly. So the most important functions here is a practice MCQ. So if you want to practice with the MCQs before your exam, you have to click this part. If you want to give the exam directly, for you want to give the mock test, you click this icon, mock test. So you click the take test. Here are the my favorite MCQs. I will go one by one. So I am going to guide you first practice MCQ. So once you click the practice MCQ, the main home page of practice MCQ will open. Here you will see your subscription. If you subscribe for 3 months, you will see here 3 months, 6 months, 12 months as per your subscriptions detail. It will show it here, right? So below that there is a start reading MCQ. So you have to click this start reading MCQ. Once you click it, right, so these are the practice MCQs, and this is the preferred category to start reading the MCQ. So there are this various clinical this subjects: cardiology, CPR, dermatology, emergency medicine, endocrinology, ENT, epidemiology, gastroenterology, general surgery, hemato-oncology, infectious disease, legal ethics, nephrology, neurology, obstetric, gynec, ophthalmology, orthopedic, rheumatology, pediatric, pharmacological, clinical pharmacology MCQ, picture MCQ, practice papers, prometric, thousands, psychiatry, pulmonology, recalls, and test paper. So this is the complete category of the subject, and this is what they ask in exam. So I'm just going to give you one example. Say for example, you are starting your practicing your MCQ with the cardiology. So you need to click the cardiology. Once you click the cardiology, there are 7 sections. So here in every subject there are sections. So section 1, 140 question, section 2, 96 questions, section 3, 90 questions. So section and number of the MCQs it is given here, and below that there is a one box that is called quick review points. So whatever the review points are there on the related subject, right, there is a quick review points on every subject. So you need to just click that, click to start reading the review points. So if you click it, you will open it. So I'm giving you the quick idea. So I'm going just for example on section 1. Click here to start reading. So I'm clicking on the box, click here to start reading. So you can see here, right? So before starting the MCQ, we recently created this page, that prometric MCQ cardiology section 1, right? So you have 114 something questions in this, but here I make one very interesting list. What I'm given the heading is important MCQ you must know below the MCQ, below MCQ for your exam preparation. So say for example you want to review all this MCQ at the last moment. You don't have the time to review all the MCQ of section 1. Then you go quickly with this number, question 3, 15, 27, 28, 30, 33, 40, 43, 58, like that. So this type of question, this number MCQ, right, it's very high yield. So if you concentrate on this 20-30 MCQ, means majority of the cardiology topic from section 1 is covered, right? So I'm going one by one. So this list will be there before every subject, right? So even in the section 2 the same list is there with the different MCQ number. Section 3 it's there. So you need to concentrate on this MCQ. These all are extremely high yield. That does not mean the other questions are not important. Obviously it is important, but these are the extremely high yield. So when you have short time, if you go through it quickly, you can cover a lot of things. So now I'm going on the section 1. Let's go. So once let's go, I will see here cardiology section 1, number of questions total, right? 1 to 114, right? So this is the complete MCQ. You can jump from one MCQ to another MCQ, say for example 1, then 10, right? So you can see here 10 to 35, you can see here, right? So you have no restriction to access the website, right? So let me go through the question number 3, right? So question number 3, they are given the example like ST elevation lead to 3 AVF suggest, right? What? So this is the question number 3. They had given the picture here of ECG. So on the whole website, if you click the picture, it will automatically get enlarged, right? So you can scroll up and down and you can see little more in details of pictures as well. And if you want to close that picture, right, so you can close the picture. So you are back to the MCQ, right? So this is MCQ, this is picture, and there are options: anterior wall MI, anterolateral MI, posterior inferior. So you need to select one options, right? So say for example I'm intentionally selecting the wrong answer just to make you understand, anterior wall MI. So see, when you select the wrong answer, it is a yellow bar. What is the correct answer? It's a green. So correct answer is inferior wall MI, right? But I selected anterior wall MI. So you can know where you did the mistake, right? So whenever you click on the any A, B, C, D, E options, if your answer is correct, it will be green. If your answer is wrong, it would be yellow. So now I'm interested in correct answer. So I answered anterior wall MI. So what the website is saying, no, it is not a correct answer. What's the correct answer? It's a D. It's a inferior wall MI. And inferior wall MI is what? It is all the descriptions given here. What is inferior wall MI, and this all related details are given here. We had given one link here as well, right? Like myocardial infarctions, right? Related link. So if you click that related link, right, you will be directed to directly to that page. So you can go and get the more details of that subjects as well. So this is how it works. So this is the one thing, right? So this is one functions on the MCQs I explained you properly. Now in the same thing, let me tell you the another extremely important point, right? That is called as a my favorite MCQ, right? On the right corner of every MCQ. So this is MCQ. There is a yellow star, right? So what's the instruction? Click here to add this MCQ into your favorite list. So this is now the color of the star is yellow. Once I'll click this, it will turn into the red. Can you see this? This is turned into the red. That means that cardiology section 1 question number 3, as it is copy paste, it will be there in the my favorite MCQ list. You need not to write down, you need not to transfer any file. It will go directly in your my favorite MCQ list, right? So if you cross check it, this is same thing. It will come to your things, my favorite MCQ, right? I have many favorite MCQs, so it is there. So you will see the MCQs here, right, which is on the red color. So whatever you created a red, all will pop up here. If you have created lot more than page 1, page 2, page 3, page 4 and last page, so whatever you selected as a favorite MCQ, it will pop up here. So this is again a very important features of the website, on the things. So now if you want to read, say for example here I popped up as a emergency medicine section 1. I turn this MCQ as a my favorite MCQ, so you can read it from here as well. So if you click it, all the options will be open. This is the questions, this is 4 answer, green answer is correct, and in the answer same way you can see here, right? So whatever you did it, right, from yellow to red, all will pop up here. So this is regarding the my favorite MCQ. So far we have seen many functions of cardiology section 1. We have learned how to use the question 1 to 114, and we have seen questions, answers, explanation, correct answer, wrong answer, and my favorite MCQ. So let me tell you one third function, One is how to use the practice MCQ, second is my favorite MCQ, and third one is quick review point. So if you can see below cardiology 7 section, there is a one another slot, quick review points. So you go and click the review point. So click to start the reading. So once you click to start the reading in quick review, you can see, because you selected the cardiology, if selected hematology will come. So once you click it, you can see this is 56. So it's a total number of review points is 56. So we are keep updating, so it will keep increasing day by day. So now you can see all the things, right? This is the one example, classical ECG finding an atrial flutter. So sawtooth P wave, so how the sawtooth P wave looks like. So this is small details. So like this, it is a very important and extremely high yield quick review points are given for every subject: cardiology, CPR, hematology, pulmonology, obstetric gynecology, and almost all the subjects we have given. So it's like a last minute revision. So if you go through it, this 56 MCQ quick review points is equivalent to 56 or more than 56 MCQs as well. So that will help you a lot for your examination.